Hi, I'm Dr. Nick Neneman with Neneman Chiropractic Clinic. Welcome to the Neneman Chiropractic video blog. This is a blog that we're going to be doing now starting every week, and we'll provide you with different conditions and topics to inform you, the viewer. This week, what we're going to talk about, it's probably one of my favorite topics to talk about, is osteoarthritis, otherwise known as degeneration, and how it relates to chiropractic. It pretty much centers around my whole philosophy as a chiropractor. What I emphasize to patients is spinal joint movement. You have 24 vertebrae in the spine. Where each vertebra comes together, that is a joint. Anytime you have two bones that come together, that's a joint. And of course, in between the joint, within the spine, there's a disc. You have the spinal joints, and you have all the surrounding tissue. Well, what happens with the spine or any joint is when it becomes shifted in position, it can become fixated. And when that area becomes fixated, over time, that's what creates stiffness, and that can lead to pain. A lot of people, when they have pain, that's when they assume they now have a problem, when in fact, they actually had spinal fixation long before the pain kicked in. When that pain starts, it's basically the body saying, I've had enough, I can't take any more of this. So that's basically what happens, and what leads to osteoarthritis. It's a common misconception with people. They just assume that as they get older, they just accept that, I'm going to get arthritis. Well, although it's a common process, it's not normal. It's an abnormal process. It's basically due to abnormal joint function. It's basically when a vertebral joint becomes fixated for a long time, it slowly degenerates. And so that's why I emphasize to people, the value of getting the chiropractic adjustment. My job is through exam and x-ray, I find out where you're fixated at in the spine, what areas are locked up or shifted or misaligned, and my job is to adjust them and to mobilize them, make them more mobile. If a person starts getting adjusted from a young age, we're going to keep their spinal joints mobile, and they really shouldn't degenerate. Because the two biggest things that I see as a chiropractor with basically how you identify degeneration is through x-ray. The two things you see is one, bone spurring within the spine, and then two is you see loss of disc height or disc degeneration. When that spine is fixated or misaligned, it's going to cause abnormal wearing. When that body senses that abnormal wear, it senses it as trauma, and so the body sends extra calcium to that area to lay down. It's basically attempting to fix the problem, but when it lays down that calcium, that's what causes bone spur buildup, and that can create a lot of discomfort. And then the other thing that happens is the disc, which is the padding in the joint between the vertebra, that disc actually starts to dehydrate, it loses water, and it shrinks in height, which approximates the vertebral bones closer together, and that creates stiffness, lack of movement. So again, this is a process that can be prevented or at least slowed down if everyone would just get adjusted. So hopefully this helps you understand the arthritic process. It's not something you just have to accept that you're going to have to live with as you age. If you take care of it now and get adjusted, you can prevent all this arthritis as you get older. I always use the analogy, you have a 7-year-old person you see jogging down your street every day, and you're like, how are they still doing that at 70? Then you have another 7-year-old that's walks with a walker all hunched over and doesn't move very well. Well, the difference is the one that's jogging, they've taken much better care of their body. So hopefully this has been informative for you, and tune in next week. We'll do another video blog on a different topic. Hopefully this has been informative for you, and we'll see you next week. Thanks.